Wellness for Life is brought to you by Back in Motion Physical Therapy and Detroit Lakes Chiropractic.
Hi, I'm Dr. Tom Wilson at Detroit Lakes Chiropractic and Neuropathy. We've done a couple sessions now on neuropathy, and we get some common questions from patients. So I want to do just a little review on neuropathy, and then I'm going to tell you how we answer some of those questions. So neuropathy involves the nervous system. If you look over here at the chart again, you can see the brain here, the spinal column, the yellow nerves that come out, go all the way down the feet, okay, down the arms to the hands, okay. So neuropathy involves the distal nerves. Those are the tiny nerve endings in the feet, in the hands, okay. And those are the nerves we test, not the big nerves, the very tiny microscopic nerves. And we have different ways of doing this. So when people come into the office, they commonly say, do I have neuropathy? And if I have it, how bad is it? And is that what's causing my problems? So we do a consultation, and they may have different symptoms like pain, numbness, tingling, burning, cramping, all kinds of different symptoms you can get with neuropathy that affect their quality of life with sleep, walking, standing, all these different things. So we have that consultation, we go over those things. That leads us to you might have neuropathy. Then we do an examination, and that basically involves testing the feeling nerves, or what we call the sensory nerves, these tiny nerve endings in the feet and the hands. And we do that without a lot of high-tech procedures. We do that simply with using different tools and feedback from the patient and what they feel. So I want to demonstrate that a little bit now. I have what's called a cold stick here. It's just got out of the freezer, and I've got a model here that's going to pretend she's a real patient. I've got Tasha here. So Tasha, when I touch you here, that's cold, right?
Yes.
Okay, so we're going to rate this 0 to 10.
Okay.
Normal, which is in your arms, that's your normal area, that's a 10. And then I'm going to touch your hands, and I'm going to touch your feet, and you're going to say it's half of it, 5. I can't feel it, 0, 1 or 2 a little bit. So that's your 10. When I touch your hand here with this cold stick,
10.
10, and I touch this hand.
10.
Okay, and if I touch the foot here.
4.
4.
10.
Okay, so that's often what happens, is that people have damage to the nerve endings of the feet. Yesterday I had a patient, she said 1. Okay, her hands were normal, her feet, she could only feel it at a level of 1. It was very shocking to her that she couldn't feel it. So that's cold. So different nerves for different sensations, okay? So then what we do is we're going to test with a pinwheel. So we're going to give the normal feeling.
10.
We're going to give the hand a test.
10.
Okay, we're going to test the feet.
4.
Okay, and this one isn't as good either.
3.
3, okay, and that's commonly what happens. So that's a prickly sensation, okay? Then what we can do is we can do what we call a sharp sensation. This is kind of like a needle stick. We can take that, we can go into the arm and stick that, and they're going to feel a sharp sensation, the patient is, and that may be at a 10 as well when it's normal. And I touch the hand, and if that's normal, that's going to be a 10. And we can do both hands, and we can just prick right in there. And then when we go to the feet, we can test there.
3.
Okay.
3.
3. So that's commonly what we find is we have a loss of sensation there in those nerve endings in the feet, and it varies. Sometimes people will have, some of the devices will show normal 10, some of them will show a 0 literally. So after we get all those numbers from the different tests that we do, and there's more tests that we do, after we get all those numbers, we put them together and we come up with a calculation. And starting from 100%, we can determine the percent of nerve damage or nerve loss for that patient. It might be 50%, it might be 20%, it could be 0 to 10, which is little to none. We have patients that have all the way up to 90 to 95% sensory loss. And that's occurred over time. Oftentimes they're diabetics, they've had chemotherapy, they've had different things. So we give them this examination. We can give you, do you have neuropathy based on your consultation, based on the examination. We can give you the amount of sensory loss. Then of course from there is what can we do about it? What do you want to do about it? So we can give you a plan of care based on what your goals are for improving your quality of life. And if you qualify as a patient, over 90% of the time, the patients have a good response to our treatment. So if you have any interest in that, you can call our office, ask for an appointment. If you just want a consultation to talk and visit and start there, we do that too, and there's no charge for that.
Wellness for Life has been brought to you by Back in Motion Physical Therapy and Detroit Lakes Chiropractic.